A power nap or cat nap is a short sleep lasting 20 minutes or less, terminating before deep sleep occurs. Coined by Cornell University psychologist James Moss, it's believed to swiftly rejuvenate the sleeper by boosting alertness and motor skills without inducing sleep inertia, that groggy feeling. The duration is crucial to avoid entering deep sleep, ensuring optimal post-nap performance. Research suggests it's effective even with a full night's sleep, making it a handy tool for quick energy boosts. Studies have explored various aspects of power napping, highlighting its potential benefits. A brief nap intends to restore alertness, performance, and learning ability. It may even reverse the hormonal impact of poor sleep or counter-sleep deprivation effects. Notably, napping has been linked to lower mortality due to heart disease, with systematic nappers showing a 37% lower coronary mortality. NASA research also indicates its efficacy in improving memory functions, mirroring the benefits of a full night's sleep for certain memory tasks. While power napping offers numerous advantages, longer or more frequent daytime naps may pose risks, potentially associated with a higher risk of Alzheimer's dementia and cardiovascular disease, though evidence remains inconclusive. However, when strategically timed and combined with caffeine, as in a stimulant nap or coffee nap, it can combat daytime drowsiness effectively. This brief sleep period, preceded by caffeine intake, has shown to significantly improve post-nap alertness and cognitive functioning, making it a popular choice for combating fatigue. Microsleeps are brief, sudden episodes of sleep or drowsiness lasting just a few seconds, where individuals may temporarily lose responsiveness to their surroundings and become unconscious. These episodes often occur unexpectedly, sometimes during monotonous tasks, and can manifest through physical signs like droopy eyes and slow eyelid closure, or detectable shifts in brain activity captured by EEG. They can pose serious risks, especially in situations requiring constant alertness, such as driving or operating heavy machinery. Despite their brevity, microsleeps can lead to accidents, with drowsy driving alone causing thousands of fatalities and injuries annually in the United States. The danger lies in the fact that individuals experiencing microsleeps often remain unaware of them, believing themselves to have been awake the whole time. Microsleeps have been implicated in various accidents and disasters, from rail and airplane incidents to tragic collisions, highlighting the critical need for their detection and prevention. With a significant percentage of drivers experiencing dangerous levels of sleepiness during late-night driving and the heightened risk of accidents in fatiguing work environments, understanding and addressing microsleeps is paramount for public safety. Detecting microsleeps involves various methods, including psychological tests, EEG fMRI, and eye video tests. However, there's no universal agreement on the best approach, leading to challenges in identifying and classifying these episodes accurately. While some research focuses on the neural correlates and underlying mechanisms of microsleeps, others explore their ties to diseases like sleep apnea and narcolepsy. Clinical studies often aim to reduce microsleeps and excessive daytime sleepiness through pharmacological interventions. Drugs like modafinil have shown promise in mitigating the negative effects of microsleeps with minimal side effects. However, microsleeps themselves are not inherently problematic. It's their potential to cause accidents and injuries due to decreased awareness that poses a threat. Therefore, interventions often target both the underlying causes of excessive sleepiness and the prevention of microsleep-related incidents, emphasizing the importance of maintaining alertness in safety-critical environments. Somniphobia, a fear of falling asleep, can stem from anxiety surrounding sleep and can be triggered by situations like night terrors or sleep disturbances. While sleep is essential for health, somniphobia disrupts this natural process, leaving individuals distressed and exhausted. Symptoms of somniphobia include avoiding sleep, constant thoughts about sleep, difficulty concentrating due to worrying about sleep, mood changes, and physical symptoms like sweating, labored breathing, and nausea. Left untreated, somniphobia can lead to psychological distress, anxiety, depression, stress, social isolation, substance use disorder, and relationship issues, significantly impacting a person's quality of life. Certain factors may increase the likelihood of developing somniphobia, such as being female, having major depressive disorder, experiencing trauma, having chronic diseases, or substance use disorder. The exact causes of somniphobia are not fully understood, but may involve past traumatic experiences related to sleep disturbances. Diagnosis is based on criteria outlined in the DSM-5-TR, requiring marked and persistent fear, avoidant behavior, and impact on daily life for at least 6 months. Treatment options include cognitive behavioral therapy, CBT, cognitive behavioral therapy for insomnia, CBTI, exposure therapy, and medications such as beta blockers or benzodiazepines. Seeking help is crucial when somniphobia affects daily life, causes distress, or interferes with healthy sleep patterns. Early intervention and diagnosis can lead to effective treatment and coping strategies, including establishing a relaxing bedtime routine and maintaining a sleep-friendly environment. Nocturnal emissions, also known as wet dreams or sleep orgasms, occur during sleep, typically during REM sleep after stressful dreams. They involve ejaculation for males or vaginal lubrication and/or orgasm for females. These experiences often start during adolescence but can happen at any time after puberty. For males, they may occur due to sexual inactivity or at any age following puberty, with frequency varying widely. In the US, about 83% of men experience them at some point in their lives. Frequency differs among individuals and can be influenced by factors like masturbation habits and testosterone levels. 13% of males experience their first ejaculation through a nocturnal emission. For females, the occurrence of nocturnal orgasms is less studied but has been reported by nearly 40% of women, typically starting around age 13 and becoming more common by age 21. However, female wet dreams may be harder to identify definitively. Culturally and religiously, various views exist regarding these experiences. For example, in Jewish law, a man who experiences a nocturnal emission undergoes ritual purification, while in Islam, it is not considered sinful, but requires ritual purification before certain religious practices. Hindu texts suggest prayers and rituals for those experiencing wet dreams. In folklore, especially in medieval Europe, wet dreams were sometimes attributed to supernatural causes like succubi, while traditional East Asian medicine viewed them as problematic, associated with evil spirits. While the causes and interpretations of nocturnal emissions vary across cultures and religions, they remain a natural phenomenon experienced by many during sleep. Sleep tracking involves monitoring a person's sleep, often by measuring inactivity and movement. Devices called sleep trackers are commonly used for this purpose and can aid in diagnosing sleep disorders as well as mental and psychotic disorders given their association with sleep abnormalities. Polysomnography, developed in the late 1950s, is considered the gold standard for sleep tracking. It involves attaching electrodes and monitors to the patient as they sleep to record various signals, but it can be expensive, uncomfortable, and inconvenient for patients, with findings sometimes affected by the first night effect. Actigraphy, developed in the early 1970s, is a wrist-worn device that tracks movement using accelerometers. While less invasive and more affordable than polysomnography, it cannot track sleep staging and still requires specialist analysis. Consumer sleep tracking devices such as smartphones and wearable devices are now widely available. While they are more affordable and convenient than medical-grade devices, they often lack reliability and accuracy. Concerns exist regarding their potential to encourage self-diagnosis and discourage seeking professional help. Despite their limitations, consumer sleep tracking devices have become more accepted by healthcare providers due to their affordability and practicality. However, they still have a long way to go in providing accurate and reliable sleep tracking information for clinical use. Studies have shown that some patients rely solely on consumer sleep tracking devices for sleep-related concerns, potentially leading to dissatisfaction with professional recommendations and delayed treatment. In some Native American and First Nations cultures, a dreamcatcher is a handmade willow hoop with a woven net or web, often decorated with sacred items like feathers or beads. It's traditionally hung over a cradle or bed for protection, originating in Anishinaabe culture as a charm meant to replicate a spider's web for infants' protection. Ethnographer Francis Densmore recorded an Ojibwe legend in 1929, attributing the origin of these protective charms to Spider Woman, who weaves webs to protect children. These charms were made by mothers and grandmothers using willow hoops and sinew, symbolizing catching harm like a spider's web catches prey. While dreamcatchers continue to be used traditionally, they were also adopted into the Pan-Indian movement of the 1960s and 1970s as a symbol of unity among Native American cultures. By the 1980s, they became widely marketed as native crafts items. However, their commercialization led to the production of derivative forms that diverge significantly from traditional styles, raising concerns of misappropriation by non-natives. Despite controversies over their commercialization, dreamcatchers have been used as symbols of hope and healing in the wake of tragedies like school shootings. For example, the Little Thunderbirds drum and dance troupe from the Red Lake Indian Reservation in Minnesota has shared a mounted dreamcatcher as a symbol of solidarity and resilience with students affected by such events. DMT, or dimethyltryptamine, is a psychedelic compound found in various plants and animals, including humans. It's known for its intense effects and short duration, earning it the nickname businessman's trip due to its rapid onset and powerful experiences compared to other psychedelics like LSD or psilocybin mushrooms. This compound can be inhaled, ingested, or injected, with effects lasting only a few minutes when inhaled or injected, but potentially lasting several hours when consumed orally with a monoamine oxidase inhibitor, MAOI. Users may experience vivid hallucinations, euphoria, and dynamic visions of geometric patterns. DMT is structurally similar to other psychedelic tryptamines and shares similarities with important biomolecules like serotonin and melatonin. It's commonly used in indigenous Amazonian shamanic practices, particularly in the ayahuasca brew, which includes plants containing DMT alongside MAOIs. Scientifically studied since the mid-20th century, DMT has shown potential therapeutic benefits, including its use in treating conditions like Parkinson's disease and major depressive disorder. Recent research suggests that DMT promotes neuroplasticity, which could have wide-ranging therapeutic applications. The subjective experiences induced by DMT can be profound and varied, often defying verbal or visual description. Users report intense visual, auditory, tactile, and proprioceptive distortions, as well as encounters with seemingly external entities, which have been represented in diverse forms of psychedelic art. DMT-induced experiences have been likened to near-death experiences or lifelike dreams. Physiologically, DMT administration elevates various biological markers, including blood pressure, heart rate, and hormone levels. While the endogenous production of DMT in the human brain is still speculative, studies have found trace amounts of DMT in various tissues, suggesting a potential role in certain psychological and neurological states. Despite ongoing research, much about the mechanisms and effects of DMT remains to be fully understood. Sleep paralysis is a state where one is conscious but fully paralyzed, occurring during waking up or falling asleep. Hallucinations often accompany it, leading to intense fear. Episodes are brief, lasting only a few minutes, and may recur multiple times. The condition can occur in healthy individuals or those with narcolepsy, often triggered by factors like sleep deprivation or stress. It's believed to result from a dysfunction in REM sleep. Lucid dreaming doesn't affect its occurrence, but some use it as a method for lucid dreams. Diagnosis is based on symptoms and ruling out other conditions like narcolepsy or seizures. Between 8% and 50% of people experience sleep paralysis, with about 5% having regular episodes. It has historical significance and is associated with stories of alien abductions and paranormal events. The main symptom is the inability to move or speak during awakening. Hallucinations include imagined sounds, pressure on the chest, and intense emotions like fear or panic. Subjects may feel dragged out of bed, experience numbness, or perceive tingling sensations. The exact cause of sleep paralysis is not fully understood, but it's believed to involve a dysfunction in REM sleep or an imbalance in neural functions regulating sleep. Genetics may also play a role, as suggested by twin studies. Different types of hallucinations, like the presence of intruders or sensations of floating, have been linked to sleep paralysis. Threat hypervigilance contributes to vivid hallucinations, often involving a feeling of suffocation or pressure on the chest. Diagnosis involves clinical evaluation and ruling out other sleep disorders. Prevention includes maintaining a regular sleep schedule, managing stress, and avoiding sleep deprivation. Treatment focuses on adopting healthier sleep habits. Medications like tricyclic antidepressants or SSRIs may be prescribed in severe cases, but no drug completely interrupts episodes. Cognitive behavioral therapy can also be helpful in managing symptoms. Sleep paralysis is experienced equally in males and females, with rates varying across populations. It's commonly associated with narcolepsy and typically occurs between ages 25 and 44. Historically, sleep paralysis was termed nightmare and was believed to be caused by demons or supernatural beings. Cultural beliefs can influence the experience, with higher rates observed in cultures where it's feared and associated with paranormal phenomena. The Sandman is a mythical character found in European folklore, known for inducing sleep and inspiring dreams by sprinkling magical sand onto people's eyes. In traditional folklore, the Sandman is a common figure in children's stories, particularly in Scandinavian culture, where he sprinkles sand or dust into children's eyes at night to bring sleep and dreams. The grit or sleep found in one's eyes upon waking is said to be the result of the Sandman's nightly work. In different cultures, the Sandman is known by various names such as John Blund in Norway and Sweden, and Klaas Valk in the Netherlands, Belgium, and parts of southern Africa. The Sandman has appeared in film and television, including the Canadian series Nihilus the Sandman, and various episodes of shows like The Smurfs, The Powerpuff Girls, and Doctor Who. In comics, characters inspired by the Sandman have appeared in Marvel and DC Comics, with Neil Gaiman's The Sandman series being particularly notable for its exploration of dreams and storytelling. The figure of the Sandman has also inspired numerous songs, including classics like Mr. Sandman by the Chordettes and hits like Metallica's Enter Sandman. Somniloquy, commonly known as sleeptalking, occurs when a person speaks aloud while asleep. It can range from mumbled sounds to loud speeches and can happen during different stages of sleep, including both NREM and REM sleep. During REM sleep, somniloquy represents a motor breakthrough of dream speech, where words spoken in a dream are spoken out loud. This can occur frequently, but is usually not considered pathological. Sleeptalking can occur by itself or be associated with other sleep disorders like rapid eye movement behavior disorder, RBD, sleepwalking, night terrors, or sleep-related eating disorder, SARED. Research suggests that sleeptalking may have a hereditary component, with children of sleep-talking parents more likely to talk in their sleep. Stress, PTSD, depression, sleep deprivation, alcohol, and fever can also trigger sleep-talking. Sleep-talking is very common, especially among children, with around 50% of young children experiencing it at least once a year. However, it tends to decrease in frequency as people get older. Treatment for sleep-talking is usually not necessary unless it disrupts sleep or causes other issues. Behavioral treatments, such as using an automated auditory signal to discourage sleep-talking, have shown some success. Managing sleep hygiene can also help reduce sleep-talking episodes, including limiting caffeine intake, avoiding electronics before bedtime, maintaining a regular sleep schedule, getting regular exercise, and creating a comfortable sleeping environment with minimal distractions. Coma sleep, also known as comatose sleep, refers to a state of prolonged unconsciousness where an individual is unresponsive to external stimuli. It is a profound state of unconsciousness that can last for days, weeks, or even months, and is typically caused by severe brain injury, stroke, lack of oxygen to the brain, or metabolic disorders. During coma sleep, the individual is unable to wake up or respond to their environment. Their eyes remain closed, and they do not exhibit purposeful movements. However, some basic physiological functions such as breathing and circulation are usually maintained, often with the assistance of medical interventions such as ventilators and medications. The depth and duration of coma sleep can vary depending on the underlying cause and severity of the brain injury. Some individuals may gradually emerge from coma sleep and regain consciousness, while others may remain in a persistent vegetative state or progress to a minimally conscious state. Medical professionals monitor individuals in coma sleep closely, using various neurological assessments and imaging techniques to evaluate brain function and detect any signs of improvement or deterioration. Treatment focuses on addressing the underlying cause of the coma and providing supportive care to maintain vital functions and prevent complications such as infections and pressure ulcers. The prognosis for individuals in coma sleep varies widely depending on factors such as the cause of the coma, the extent of brain damage, and the individual's overall health. Some individuals may recover fully and regain consciousness, while others may experience long-term disabilities or remain in a state of profound impairment. Coma sleep is a complex and challenging medical condition that requires specialized care and management. Family members and caregivers play a crucial role in supporting individuals in coma sleep, providing emotional support and advocating for their needs throughout the recovery process. Night terrors or sleep terrors are a sleep disorder characterized by sudden feelings of panic or dread, often occurring during the initial stages of non-rapid eye movement, NREM, sleep. These episodes typically last for a brief period, ranging from 1 to 10 minutes but can extend longer, especially in children. They are classified as NREM-related parasomnias, occurring during sleep onset, sleep, or arousal from sleep. Night terrors commonly start in childhood and tend to decrease with age. Various factors such as young age, sleep deprivation, stress, medications, fever, and intrinsic sleep disorders can contribute to their occurrence. The intensity and frequency of night terrors vary among individuals, with intervals between episodes ranging from minutes to weeks. These episodes often coincide with periods of arousal from deep, slow-wave sleep, primarily occurring in the first half of the sleep cycle. Night terrors can sometimes be mistaken for confusional arousal. Unlike nightmares, which are more common and occur during rapid eye movement, REM sleep, night terrors are less frequent and occur during NREM sleep. During a night terror episode, individuals may exhibit intense fear and panic, accompanied by autonomic signs such as rapid breathing, sweating, and increased heart rate. Despite appearing awake, they remain unresponsive and may engage in complex motor activities like thrashing or sleepwalking. However, upon awakening, they often have no memory of the episode, although brief dream images or hallucinations may be recalled. Night terrors are more prevalent in children, with estimates ranging from 1% to 6%, peaking around 3.5 years of age. Most children outgrow sleep terrors, and pediatric evaluation is often necessary to rule out other conditions like seizure disorders. In adults, night terrors are less common, but can occur due to various factors such as poor sleep quality, stress, or underlying psychiatric disorders. The exact causes of night terrors are not fully understood, but may involve genetic predisposition, sleep deprivation, fever, medications, or respiratory issues. While familial aggregation suggests a genetic component, environmental factors like stress or trauma can also play a role. Diagnosing night terrors involves assessing the frequency, duration, and characteristics of episodes, ruling out other sleep disorders or medical conditions, and evaluating the individual's sleep-wake pattern and environment. Polysomnography may be recommended to exclude other disorders, although capturing a night terror episode in a sleep laboratory is challenging. Treatment for night terrors often focuses on reassurance, creating a safe sleep environment, improving sleep hygiene, and addressing underlying stressors. Hypnosis, psychotherapy, or medications like benzodiazepines may be considered in severe cases. Overall, Understanding the triggers and managing stress can help reduce the frequency and severity of night terror episodes. Prophetic dreams, also known as precognitive dreams, are a fascinating phenomenon where individuals experience dreams that seemingly foretell future events. These dreams often involve vivid, detailed scenarios that later unfold in waking life, sometimes days, weeks, months, or even years after the dream occurs. While the scientific community remains skeptical about the existence of true prophetic dreams, anecdotal evidence and personal accounts of individuals experiencing such dreams are plentiful throughout history and across cultures. Proponents of prophetic dreams argue that they offer glimpses into the subconscious mind's ability to tap into information beyond our immediate awareness. One theory suggests that prophetic dreams may arise from the brain's processing of subtle cues and patterns in the environment, allowing it to subconsciously anticipate future events. Another perspective views prophetic dreams as a form of intuition or extrasensory perception, suggesting that certain individuals possess heightened psychic abilities that enable them to perceive future events in their dreams. Accounts of prophetic dreams vary widely, ranging from simple, everyday occurrences to significant historical events. Some people report dreaming about specific details of future conversations, encounters, or travels, while others claim to have foreseen major disasters, accidents, or life-changing decisions in their dreams. Despite the lack of scientific consensus on the validity of prophetic dreams, many individuals continue to believe in their potential significance and seek to interpret them for guidance or insight into their lives. Whether viewed as a product of the subconscious mind, intuition, or psychic ability, prophetic dreams remain a mysterious and intriguing aspect of human experience, challenging our understanding of the nature of consciousness and the boundaries of time and space. Many individuals claim to have awoken in darkness to encounter a shadowy figure known as the Hat Man. This phenomenon has garnered widespread attention, sparking documentaries and the establishment of the Hat Man Project, a platform for people to share their encounters. The Hat Man, described as a frightening nighttime vision, has been documented for centuries in various cultures. Victims often report feeling paralyzed with fear, experiencing a sensation of breathlessness as the figure looms over them. The appearance of the Hat Man typically involves a tall silhouette wearing a brimmed hat, often encountered when individuals are in bed between sleep and wakefulness. As discussions about the Hat Man proliferate online, the myth gains momentum, leading more individuals to recognize the figure in their own experiences. While the precise cause of hallucinations like the Hat Man remains unknown, experts suggest they may occur when individuals experience vivid dreams of REM sleep while awake. Some propose that cultural influences, including horror films, may shape perceptions of such phenomena. Psychological research indicates that individuals who fear supernatural entities during sleep are more likely to experience phenomena like the Hat Man. Across cultures, attributions of sleep paralysis to paranormal causes can amplify the fear and distress associated with these experiences.
Like this video and subscribe to Maker.